I'm Dr. Campo with Nuvance Health Cardiovascular Institute. Today I have with me Dr. Gemayel, who is a cardiologist with Nuvance Health in our Danbury campus. She will be discussing heart disease risk factors and some specific risk factors for women, as this is Women's Heart Month. Dr. Gemayel, can you tell me a little bit about risk factors such as diabetes and high blood pressure?
Yes. So cardiovascular disease remains the leading cause of death in women, and awareness has improved over time, but it has stayed steadily since 2006, especially among minorities and ethnic background women. We do want to know that women are at risk of heart disease, not only after menopause, but some young women can come with heart disease, and those women tend to have higher mortality. We still see that education, awareness, and risk factors stratification of women's cardiovascular disease is far from expected. So there are traditional risk factors for heart disease that are same for men and women, and there are sex unique risk factors. So I'm going to talk about hypertension and diabetes as risk factor for heart disease. So hypertension, what is hypertension? Hypertension is blood pressure more than 130/80. We do know that untreated blood pressure can lead to long-term sequelae such as heart disease, heart attack, stroke, peripheral arterial disease, and kidney disease. We see that the prevalence of hypertension to be higher in women more than age of 60, and women with hypertension tend to have higher mortality as compared to men. So we really want to make sure that women who are diagnosed with hypertension have optimal blood pressure, and we want to make sure that women ask their physician, what is my optimal blood pressure? Where is my blood pressure should be? So medication is how we treat patients with blood pressure, but also we need to focus on lifestyle changes, and we want to make sure that women are aware that not only taking medicine, also changing lifestyle. If woman is overweight or obese, they need to work on losing weight. If they should be exercising. If they have sedentary lifestyle, we recommend routine cardiovascular exercise, and also watching their diet, such as following the DASH diet or the low sodium diet. Now, how about diabetes? Diabetes is also a significant risk factor for cardiovascular disease. It can lead also to long-term sequelae if it's untreated or not treated properly, kidney disease, heart attack, stroke, and peripheral arterial disease. What we have seen that diabetes is a greater risk for cardiovascular disease in women, more so than men, increasing women's risk by 3 to 7 times as compared to only 2 to 3 times in men. The American Diabetes Association recommends screening for diabetes, both in men and women, as early as age 45, and continuing every 3 years if the results are normal. Obviously, if someone has risk factors such as strong family history, overweight, obesity, the screening should start earlier. Now, what are the risk factors for diabetes? There are modifiable risk factors, and there are non-modifiable risk factors for diabetes. Non-modifiable risk factors, genetics. If you have such a strong family history, some ethnic background, getting older, these things we cannot modify. But there are modifiable risk factors like weight, overweight, obesity, physical inactivity. All these are things that women can work and to decrease the risk of having diabetes or prediabetes. So we really want to make sure that women know that physical activity is important. Doing 150 minutes of cardiovascular exercise a week decrease the risk of having cardiovascular complication down the road. Also, weight. So if someone loses 5 to 7% of their body weight, the risk of developing prediabetes is decreased by half. So it's important to know, what you can do from your side in addition to taking the medication and following your doctor's recommendation. Now, how about sex unique risk factors?
Right. Yep.
This is important for women to know, that when they are pregnant and if they develop preeclampsia, eclampsia or gestational diabetes, that this is going to be a risk factor long-term for developing cardiovascular disease. So what is preeclampsia? Preeclampsia is a hypertensive disorder that can affect 22% of women during pregnancy. It's usually detected after 20 weeks of pregnancy. But we know that women who develop preeclampsia are at increased long-term cardiovascular risk, including 2 times increased risk of premature coronary artery disease, 2 times increased risk of stroke and heart failure, and 4 times risk of developing hypertension later on in life. Those risks can occur as early as 5 to 10 years after delivery. So, what we tend to see in those women who develop preeclampsia, that they can come present earlier in life, as young as 50 or, earlier with cardiovascular problem. So the American College of Obstetrician and Gynecology recommends that any woman who develop hypertensive disorder during pregnancy to be followed closely as soon as 12 weeks after delivery, assessing the risk factor, monitoring their blood pressure, and carrying on throughout their life all the time. Now, how about gestational diabetes? Gestational diabetes is diabetes that occurs during pregnancy. We know that this also increases the risk of developing diabetes later on in life. And women who develop gestational diabetes should be screened as soon as 6 to 12 weeks after delivery for diabetes, and continue later on every 1 to 2 years to be checked for diabetes. Gestational diabetes increases the risk by 1.5 times for having cardiovascular disease down the road. The cardiovascular prevention guidelines added gestational diabetes as a risk criteria, making sure that physicians taking care of those women assess those women risk factors and make sure they check on them later on in life. So now the question is, how we do assess women's risk factor? When woman comes to us and they have family history, they have risk factor, hypertension, diabetes, what tools do we have to assess risk factors? We know that assessing risk factor and treating risk factors is better than treating the disease itself. So when I have a woman who comes here, we talk about what risk factor they have, be it, the family history, smoking, hypertension, diabetes, but we want to talk about women pregnancy, if they were pregnant, if they had any complication during pregnancy, be it eclampsia, preeclampsia, gestational diabetes, or preterm labor, because these are considered as risk enhancers. And the formula that we use to assess the patient risk factor is the 10-year risk atherosclerotic cardiovascular disease. This is the one that's recommended by the 2018 cholesterol guidelines. It is validated in women, and it can risk assess and stratify the women. Are they at low risk? Are they in the middle, intermediate risk, or are they at high risk? And that formula, that equation, also add those sex-unique risk factors, including premature menopause, age less than 40, or having eclampsia, preeclampsia, gestational diabetes during pregnancy, or preterm delivery. Now, there are other tools we can use in certain patients. Not necessarily every patient needs to have other tools of assessing the risk factors. One of the tools that we use is the coronary calcium score. It's a CAT scan of the coronary artery. It is very quick, minimum dose of radiation. And what it detects the calcium buildup, or the plaque, the buildup in the calcified plaque in their coronaries. And that test will give the patient a score, and based upon the score, we can risk stratify the patient and reclassify them. For example, if we had patients who are in the intermediate risk of having cardiovascular disease or borderline, and we want to treat them, we want to consider using cholesterol medication or adding aspirin, for example, for primary prevention, we can use that tool to reclassify them and then see if they benefit from using statin therapy to lower their cholesterol. So we can reclassify them, whether they become higher risk or lower risk. It's a very good tool to have, and we know that the higher the score, the higher the risk of having cardiovascular event over time.
That's a fantastic summary of just basic risk factors for everybody in general, and in particular, sex-specific risk factors for women. I think it's important that what you said is something that we need to discuss more, that women get diagnosed with conditions such as preeclampsia, gestational diabetes at a young age, and then sometimes they don't follow up with a medical provider, or their true risk for heart disease is not assessed. And then using the calculator to assess risk, or the calcium score. Thank you so much for this for this fantastic summary, Dr. Gemayel. Is there anything else you would like to add before we close on this session?
No, we just, want that women to know, that they're not protected because they still, they're having, till menopause, the incidence after menopause start to go up higher. And then the risk of heart disease become as equal as men after menopause. So, the thought years ago that, okay, women are protected. In reality, no, we really need to make sure women are aware of their risks. If they have risk factor, they need to be assessed like we assess men using the formula, risk stratifying them, checking on their blood pressure, checking their cholesterol, making sure they are screened properly for diabetes. Because also women younger than 50, before menopause can come with heart disease, especially if they have significant risk factors. And those women tend to have higher and mortality and worse outcome. And if we can intervene early on and take care of the risk factor, we can prevent, major problems down the road.
Right, and I think that's an important part of the message, that it's not just about evaluating for risk, but it's also, we can do something about this if we can catch this early. Thank you, Dr. Gemayel, for this fantastic summary.
Thank you.